Hi mga arthritis warriors, this is Dr. JOF, your trusted source sa mga hip and knee arthritis. So today we are going to do an Ask Dr. JOF because naatay chat group, we do have a chat group and itong chat group na to ay very specific. Para po ito sa mga patients na nangangailangan ng mga hip replacement surgeries. So we have a group, it's free to join, and if you do know someone with hip osteoarthritis, hip AVN, hip fractures, it's a free group to join. And these are the questions na nanggaling sa ating chat group. So we're going to go through them one by one, and hopefully you can get more value from this Ask Dr. JOF na skit. So please like, follow, and share this with your friends if you found this useful. Question number 1 sa ating mga AVN warriors. Doc, mostly napuntahan ko mga ortho, di talaga makita bakit ako nagka-AVN. So, salamat sa tanong. Yes, it is true. You cannot always find the root cause of AVN. Meron tinatawag na idiopathic. When the AVN is idiopathic, it just means that we cannot find a probable cause. But most Filipinos I've seen are lifestyle related. They can be alcohol users, they can be smokers. There are even medications that can cause AVN like mga steroid medications, anti-cancer medications. And if you are someone with problems in the blood, meron kayong mga problems sa blood such as certain leukemias or clotting disorders, pwede po kayo magkaka-AVN po. We do different blood tests, x-rays, MRIs to see the possible causes of AVN. And one of the possible causes here in the Philippines is tuberculosis. TB can be in the lungs, it can also go to your bones, and it is relatively common here in the Philippines. So we always get a chest x-ray, and for me personally, I get a chest x-ray and make sure that the patient does not have symptoms of TB or a history of TB in the family, because that is one major cause of AVN that we can rule out, no? It's also very treatable cause ng AVN and arthritis sa hip joint. Remember mga arthritis warriors, when we were talking about the hip joint that we are talking about is the ball and socket joint, which is your groin, your singit, sa uban bugan or punuan po. So if you have problems sa singit, sa punuan, or sa bugan, dapita, that may be a hip problem. Please consult a doctor. So I hope you found this useful. Please like, follow, and share this with your friends. We're going to question number 2 sa atong AVN warriors. Doc, Jof, meron po bang congenitally cause of avascular necrosis or osteoarthritis? Yes, that answer is yes, very much po. Meron pong possible congenital causes of AVN, and this is usually late stage na makikita. It starts with a dysplasia or a hip na wala sa tamang pwesto, so it's a chronically dislocated hip, and through time this bone can undergo avascular necrosis, osteoarthritis secondarily, meaning to say dahil wala yung bone sa pwesto, because the bone is not in the proper place, it slowly dies with time. Sometimes it has an arthritis that forms. So again, not every patient is the same, and this is one of the rare or not so common causes of AVN, because usually this happens to have osteoarthritis, yung mga dysplasia. They don't automatically go to AVN po. So thank you for your question, and the answer is yes po. Pwedeng mga congenital abnormalities later in life can cause AVN. And there are different also causes of AVN in the hips in children, but those are for our fellow colleagues na pediatric ortho po. So iba po yung pediatric na conditions in the hip that is treated by a pediatric orthopedic. Next question sa ating Ask Dr. JOF sa mga AVN. Hi, Doc Jonathan. Good evening po. Ask ko lang if pwede po ba magka-vaccine ako after my hip replacement. Vaccines aren't really an issue. Yes, you can go ahead and get a vaccine after po your hip replacement. So, a lot of patients think na bawal yung certain na mga gamot, and it's always a good idea to ask your doctor if you are taking certain medications that could interfere with the vaccine, baka bawal. But in general po, vaccines, not an issue for patients who have undergone yung hip replacement surgery po. So, if you found this useful, like, follow, and share this with your friends. And join the group natin na Hip and Knee Arthritis Philippines. Or if you want to get that free guide, we are now giving away a free guide on how to walk back into life, and that is the name of our guide for modern hip replacement. You can download it at the Hip and Knee Arthritis Cebu Facebook group. So it's a free guide. You can go to the group and just download it. So next question sa ating mga Ask Dr. JOF segment is, Doc Jonathan Flordelis, I am 1.5 years na po after my hip replacement. Mag-ask sana po ako if okay lang mag-take ng collagen supplements. Thanks po. Thank you for your question din, Ma'am Mel. And the answer is supplements are generally okay after joint replacement surgery, hip replacement surgery. You can definitely take a collagen supplement. Collagen is good for your bones, your muscles, and of course, your hair and teeth. And of course, do not just take supplements. Do eat properly, do exercise, do sleep right. Physical therapy is still very important after surgery. So if you are thinking that supplements can be the solution to certain problems after surgery, it's really better po if we identify what problems you have para mabigyan natin ng solution. But generally, yes, you can take any vitamins or supplements after po your hip replacement surgery. For those of you who are interested in hip replacement surgery or getting a hip replacement done, join po our free Facebook group, Hip and Knee Arthritis Cebu, where we can give you a free guide on how to walk back into life, a guide for modern day hip replacement po. So, thanks for your question, Ma'am Mel, and let's proceed to the next question sa ating Ask Dr. JOF segment here sa AVN mga patients natin, no? So, Doc Jonathan, good eve po. Ask ko lang po, bakit kaya masakit yung muscle ko sa part na inoperahan? Hirap po ako maglakad kasi masakit po siya. 2 years na po ako after my total hip replacement surgery. So, in general, if you are 2 years, not 2 years after hip replacement surgery, and masakit po yung muscle nyo, the next question I have is, did you do a formal physical therapy? If hirap po kayo maglakad, if paika-ika po kayong maglakad, most likely po, your muscles are very weak, and because your muscles are very weak, hindi kayo makakalakad ng maayos, you have these muscle aches and pains, because the muscle needs specific exercises po for you to walk properly and to walk without pain. Kasi pwede po kasi na yung muscles nyo are weak after 2 years, and a lot of the patients think po, akala nila just by walking, lalaki po yung muscle. I'm sorry, but that doesn't happen. Walking can definitely improve some of the muscles, but it does not improve your balance. And the muscles for balance are very important to strengthen. Specific muscles for strengthening, specific physical therapy and rehabilitation po yung kailangan for strengthening the muscles. So if you have muscle pain after your hip replacement surgery and you are 2 years already after po your hip replacement, I would recommend you go to your doctor, your surgeon, and of course, get an assessment, number one. Pero in general, feeling ko lang you are someone who did not undergo proper and formal physical therapy. Yung PT-PT lang is not the same. You need to go through a rehab doctor, a licensed physical therapist, and then you can strengthen slowly. And over 1 month, mawawala dahan-dahan yung pain sa muscles, makakalakad kayo ng mas maayos po. I hope this helps, and I hope you guys who are interested in hip replacement can get my free guide to Walking Back to Life, a modern guide to hip replacement surgery. It's free. You can get it sa Facebook group po natin. The Facebook group is sa Hip and Knee Arthritis Cebu Facebook group. You can get the guide in the file section and it is free to download. Next question po natin is, Doc, totoo po ba na kapag posterior approach, prone sa dislocation? So, yung tanong na to is a question about the different hip replacement approaches. So, medyo mas deep na yung tanong ni Sir. So, if you are a patient considering a hip replacement, it is true that historically, mas mataas po yung posterior approach. Approaching the muscle from the back is posterior. Approaching the muscles, the hip from the front is anterior po. Tapos, every surgeon will have their own preference. Ngayon, with the modern techniques, it's not necessarily na true na mas prone to dislocation yung posterior versus anterior. There are many factors to consider po. Component is just one, approach is another. So component positioning dapat tama. The approach is a factor depending on how you fix the muscles and the tissue. Because if posterior naman, tapos you fix all the muscles and the capsule, you can have a very low dislocation rate. And of course, other issues for dislocation can be the muscle tension. Pag walang muscle yung patient, walang muscle tension, even if it's anterior or posterior, tapos the components are still in the right position, pwede pa rin mag-dislocate. So again, there are many factors to consider with regards to dislocation. This is something that is very deep and detailed na questions po. It's very important that you discuss this with your surgeon po. And it's really interesting to note that ngayon, maraming nag-i-inquire about the direct anterior hip replacement because it is not cutting any muscles to go to the hip and do a hip replacement. That is why relatively more surgeons here and abroad are learning about direct anterior hip replacement. So, thank you for your question. And if you are someone who is interested about hip replacement surgery because naamoy pain in the groin pain, sakit sa singit, sakit sa bugan, or sakit sa punuan, you can definitely get the free guide to hip replacement. It is available in our Facebook group. The Facebook group is free to join, and it is Hip and Knee Arthritis Cebu Facebook group. You can download the free guide for yourself or for your friends or family who need a hip replacement. So, thank you for that question. Tuloy po tayo sa ating Ask Dr. JOF segment on hip AVN. Doc, ako po ay after hip replacement na. Natatakot po ako na maglakad or mag-jogging. advisable po ba mag-jogging? Though nagwo-walking ako and nagwo-weights sa gym. Generally, light jogging is okay. We want to avoid high-impact sports with a lot of jumping and jogging. As long as you're doing it with your doctor's permission, should not be a problem. Again, every patient is different. Every circumstance may be different. So it is always best to ask your doctor. But in general po, there are patients who are doing more than just jogging. Some are running, doing triathlons, doing skiing. And I wouldn't really say that I would recommend this for all patients. But each patient kasi in hip replacement is unique, is different. That is why I would always advise you to consult your doctor. For myself naman and my patients, I individualize them po. Yung AVN warriors natin na group is a very big group composed mainly of young patients na nagkakaroon ng severe arthritis at a very young age. And these are patients na relatively active, who want to go back into sports. And for those of you who are relatively more senior, who require also a hip replacement, these jogging exercises may not be the best exercises for you. So again, each patient po is different, and that is why if you're interested more about yung mga hip replacements, you can get the free guide on walking back to life. A free guide about hip replacement, you can get it at the Facebook group Hip and Knee Arthritis Cebu Facebook group, and download it in the file section for free. Much love and respect. This is Dr. JOF, and we are going to continue po yung mga Ask Dr. JOF na tanong sa AVN Warriors chat group. Doc, ask lang sa experience niyo po from surgery ng hips, gaano katagal yung pain? And saang part yung pain and anong klaseng pain? Thanks. Well, thank you for this very interesting question po. So, number 1 is gaano katagal yung pain? Gaano katagal yung pain? Usually, in my patients, direct anterior hip replacement, the pain typically from surgery goes away after mga 3-4 weeks. But if you are someone with weak muscles, the muscle pain can be because of the weak muscles. Again, I do it differently from other doctors. So asking your doctor for the approach, whether it's lateral, posterior, anterior, can also affect the pain that you feel afterwards po. Now, second question, saang part yung pain? Most of the patients will have pain around the muscles na inoperahan or sa muscles na around the hip replacement po. And again, the muscle sparing approach or muscles can be cut in some hip replacements. In the direct anterior hip replacement, which we are doing more and more now, no muscles are cut, and so we have patients walk immediately with very less pain. So the last question is anong klaseng pain? It's mostly muscle pain po. And the muscle pain can be feeling ng bugbog or feeling na nabunog ang lawas. And this muscle pain usually goes away after about 3-4 weeks. Again, every patient is different. Not every patient will have the same type of pain because there are different types of approaches and the patients will have a case-to-case basis po. But this is a very interesting question. I hope you found value in this. And if you are interested po in about hip replacement surgery, please get the free guide. It is available in our Facebook groups, Hip and Knee Arthritis Cebu Facebook group. And you can download the free guide, which is Walking Back to Life, a modern guide to hip replacement surgery po. So, let's proceed to the next question. Next question is very related po sa previous question. Doc, masakit po ba kapag lateral approach? From someone who's done posterior, lateral, and anterior approaches, I can say that this is relatively case-to-case din yung basis. The pain kasi is dependent, number one, on the patient. Not all patients have a high pain threshold or a low pain threshold. So the type of patient matters. The lateral approach is usually done cutting muscles, so it may be a little bit more painful compared to the other approaches. And again, each will have his own experience. The lateral approach can also be affected by the type of anesthesia that your doctors use. Some doctors have cocktails of different medicines and anesthetics that can make your life easier. The physical therapy doctors will also have a different approach to pain. So whether it's an anterior, a posterior, or lateral approach, you will expect to usually have different doctors treating you and making sure that you are comfortable. So kahit anong approach, the doctors will work together, yung rehab doctor, yung anesthesia doctor, yung internists at saka yung surgeon will try to give you your best care naman po. And the pain of arthritis is definitely a lot more than the approach na pain. So let your surgeon do the approach that he is comfortable with, and you will still get good quality of life after surgery po. I hope that helps, and I hope that you guys got value from this. Please like, follow, and share this with your friends if you found this useful. Also, don't forget to get the free guide on Walking Back to Life, a modern guide to hip replacement surgery. It's available sa Facebook groups, Hip and Knee Arthritis Cebu Facebook group. And you can download it for free dun po. So let's move on to the next question. And the question is again from the AVN group. Doc, required po ba yung rehabilitation and physical therapy? Is this required bago mag-surgery and after surgery? Ilang sessions po ng PT and rehab kailangan? Very, very interesting question. Thank you sa tanong. And personally, I now require patients to do a pre-surgery rehab before the surgery. But of course, it is not for everyone. If the pain is really very, very severe and any type of movement can cause you pain, then maybe PT and rehab before surgery is not for you. Especially pag yung patients may fracture or severe arthritis na sobra na yung pain, then definitely we can have the physical therapy afterwards. I think that just doing physical therapy one session before, or even talking to the rehab doctor will alleviate a lot of fear and a lot of anxiety before the surgery. Because alam mo na, you can be advised on what to expect during the surgery. You can talk to the PT and you can get to know them, their routines, even if you're not doing it yourself. So a pre-surgery rehab or at least a rehab orientation is very useful. Pagkatapos naman ng surgery, after surgery, ilang sessions yung rehab and therapy. I typically would like to patients to do the therapy until mawala yung paika-ika, until we get rid of that limping. That is the time that we stop the therapy, because balance is very important, and without this balance, pwedeng paika-ika po kayo even after a year or two of surgery. The limp and muscle pain does not go away unless you exercise specific muscle through rehab and physical therapy. So thank you for this question, and it's very interesting. Again, I personally have a requirement for a pre-surgery orientation, and you can learn more about this in the free Walking Back to Life, a modern guide to hip replacement surgery. The guide is free and you can download it sa Facebook group natin, Hip and Knee Arthritis Cebu Facebook group, and just get our guide about hip replacement or share it with a friend and family member who believes that she may need a hip replacement if she has groin pain, sakit sa bugan, sa singit, or punuan. So much love and respect. I hope you found this useful. Like, follow, and share this with your friends if you found it of value. Moving on to the next question sa AVN na Warriors chat group. Doc, limited po ba yung mga movement after surgery? Okay, so this is a very interesting question because there are certain doctors, and depending on your approach, whether it's lateral, posterior, your doctors may give you specific limitations in the first 2 to 3 months of surgery to avoid dislocations. And after those limitations of 3 months are done, most patients can do almost any movement na wala ng dislocation precautions, generally after 3 months. But this is dependent on the approach, whether it's lateral or posterior or anterior. There may be doctors who have no dislocation precautions because nakita nila inside the surgery na very stable. Others will definitely give you dislocation precautions, meaning bawal mag-De4 for patients na naka-lateral approach, and bawal mag beyond 90 degrees na flexion yung hip. And again, bawal umupo ng mga masyadong mababa. So you cannot do certain things. You can't sit down on a very low chair with certain approaches depending on your doctor. So these are very important details to discuss with your surgeon. So thank you for this question, and I hope you found this valuable. Please like, follow, and share this with your friends if you found this useful. And again, I'm inviting everyone to just download the free guide on Walking Back to Life, a modern guide to hip replacement surgery. Available po sa Facebook groups for free to download. Just join the Hip and Knee Arthritis Cebu, Hip and Knee Arthritis Cebu Facebook group, and download our free guide. Okay, so the last question that we have for today is, Doc, hirap po ako mag-decide if hip replacement po ba or mag-wait pa ba. My hip pain started in 2020 and I was diagnosed with AVN po. It's been manageable, kaya lang this year, everyday masakit na po siya ulit. Well, thank you for this question. And sir, I do believe na if you are feeling everyday na po yung pain, and if you have had AVN since 2020, it's very possible na severe na po yung pain nyo. And if severe na po yung pain nyo, everyday sumasakit na siya, this may be the time to do something about it na po. So please don't wait until it's too late, because you will lose a lot of time, quality time with your family, with your friends, and loved ones. So please consult a doctor near you, and hopefully you can arrive sa tamang decision po, because you will definitely need a new x-ray kasi yung last x-ray niyo was, I don't know, was it 2020 or 2024? Get a new x-ray, have a assessment with a hip specialist na malapit po sa inyo, and I hope that you decide po. Again, every patient is different kasi, and if you have severe pain, if you have AVN, it's very possible na need na po niyo ng surgery ngayon. But again, this is depending on you and your doctor po. So, get an x-ray, get a consultation sa isang hip specialist near you. Much love and respect. This is Dr. JOF. This is the last question that we have to answer. Again, I hope you got value. Please like, follow, and share this with your friends if you found this useful. And download our free guide sa Walking Back to Life, Modern Hip Replacement Surgery Guide. Available po sa Facebook group, Hip and Knee Arthritis Cebu Facebook group. Much love and respect. This is Dr. JOF. I'm here to put the ability back in your life so that you can spend it with your loved ones. So, I hope to see you next time sa ating Ask Dr. JOF segment. Bye-bye. Yeah.